What if you could have the practice of your dreams? What's holding you back? Imagine a life where you have everything you ever wanted. Welcome to Accelerate My Practice. So glad you could join us here today, here in the AMP TV studio. Hopefully you've been enjoying the whole series we've been doing over the past few weeks, role-playing various topics. That was a request that came to us from a handful of clients of, hey, how do you handle this? What conversations do you have with the patient? And give us real-world stuff. Don't give us some scripted, boring, unreal sort of content. So we've been in the past few weeks role-playing all these topics. We started with how to get the patient to pay the bill. We went to hygiene. We covered periodontal disease. And the next one we're going to hit is going to be all about case acceptance. But prior to doing that, I really wanted to cover some of the psychology behind how to get a patient to say yes, because then we can role-play that very psychology. So that's what I want to discuss here with you today is some of that sort of content, the psychology of how it all works, how it all wraps up together. And I have a fun little video we'll play somewhere in the middle about the same stuff. So if you look at the psychology of consumerism, how do people make decisions? Because your competition, I believe, is not the other dental office. I do believe your competition is Apple, Best Buy, Carnival Cruise, Ford, GM, any sort of discretionary spending that people, what they would like to spend their money on. And so the issue there becomes, how can we understand what that means and what that is? And so that's what we're going to discuss. Because when people are trying to figure out where they want to spend money, what it is they want to do, it's all about the end result, having fun, enjoying life, gaining pleasure, or avoiding pain. If you follow Tony Robbins' content at all, he talks a lot about this very topic, that people will make change for one of two reasons, either to avoid pain or to gain pleasure. And so that's the basis of all of the psychology. So if you look at the example buying a car, when people are looking at buying cars, if their car is broken, their existing car is broken, they're contemplating buying it because they're going to avoid the pain of paying the bill while simultaneously gain the pleasure of the new car. The new car smell, the fun little buttons, the excitement, they get to show it off and compete with the Joneses sort of mentality. And so we need to understand that when it comes to dentistry, because it all relates. So your competition really is any discretionary spending source where people could be looking to spend their money anywhere else. And of course, the argument I get from lots of people is, well, Darren, I've got patients who are calling me all the time, and when they call, they're asking how much our fee is so they can go to the lesser expensive dentist. And my rebuttal to that is the reason why they're looking to save that $100 or that $200 or however many dollars it is because they want to save it so they can spend it at the Apple Store and the iPhone 6. So it still all goes back to discretionary spending. They're trying to save their money so they can spend it on something else. And I understand why that is. We're all the same way. So think about yourself for a moment. As you're sitting there perusing some shop or shopping online and you're contemplating, do I buy this? Whether it's for myself, for my significant other, for my child, we're all making decisions about where we can spend our money because we all have less than we used to. And so we're all sitting there thinking, well, should I do it this way? Should I do it this way? Or where should I spend it? And that same decision-making process is what your patients do. And you really got to back up and consider yourself much like they do as to how that decision-making takes place. And I really think if you go back to this pain or pleasure concept, you're going to see that there's a big piece of reality there that'll make perfect sense as you start to contemplate that. So what we really need to think about is how is this patient presenting themselves to us? Are they in the avoid pain or are they in the gain pleasure sort of modality? And the reason why I say that is One of the easiest cases to sell is when a patient comes to you saying, hey, I'd like a full mouth makeover. I realize it's going to be $20,000, but I want a full mouth makeover. In that instance, all we need to do is answer their questions, provide value, differentiate ourselves from whoever else they might be talking to, and it's incredible how all of a sudden then they say yes to the treatment. And so that's probably one of the easiest cases to get accepted. Another easier case to get accepted is when my face is blown up and I'm in pain, and you're either going to do a root canal or an extraction and give me some medication because I'm avoiding pain. Very, very easy circumstance. Now, the harder cases to get accepted are the patients who come in and they aren't expecting any dentistry. They're just there for a cleaning, or so they think. And they are coming in with the anticipation of, hey, I'm just going to get a cleaning and then we're going to move on and it's no big deal. So that's going to be the hardest case when all of a sudden you're looking at them going, hey, you need a $1,000, $2,000, or $3,000 or $4,000 of dentistry that you're not expecting, and now you're shell shocked. And therein lies a massive challenge of how to do it. So there's a few things I want to discuss here in the psychology. One is the timing of how we do this. Secondly, then, is how are we going to actually present it to the patients, because they're going to be shocked by this and not understand what's going on. And so in their instance, they're challenged and they're overwhelmed, and so if you're coming at the end of the exam to do this, they're going to be sitting there going, oh my Lord. And so we need to talk about sequencing. So what we want to do there is we want to contemplate in the hygiene exam having a patient be prepped for what this is going to be early in the appointment rather than in the last 10 minutes. Because normally what happens is the hygienist is doing the cleaning, and then the doctor comes in the last 10 minutes to do the exam, and now all of a sudden we're shocking them with this big news of, hey, you're getting a $3,000 bill that you have to pay. And they sit there going, oh my Lord. And so they don't know all the questions they have to ask. And so what they end up doing is saying, let me think about this and I'll get back to you. And therein lies why sometimes a lot of patients walk out the door without their treatment accepted. So conversely, if we can present this treatment earlier in the process, it's a game changer. And we've done show content on this, on the hygiene handoff as we phrase it. And so I won't spend a lot of time there, but I want to spend a few minutes because I think it's wildly important here. So what we want to do there is, if the hygienist can prep the patient with, hey, I think doctor's going to tell you, you need this, 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 and this. It gives the patient the time to contemplate it, to get over the shock of it, to ask the hygienist questions. So now when the doctor comes in to do the exam, they're well prepared. They've asked all their questions. They're feeling better about it. They're not happy, of course, but they're feeling better about it, and thus it becomes an easier process. Offices we find that implement this, they see transformation in terms of their case acceptance rates. So in hygiene, move that stuff to the beginning of the appointment and prep the patient so they can start asking those questions, and they can do their 20 questions to you during the hygiene cleaning versus waiting for the doctor exam. And then all the doctor has to do is, it's a layup for him. He comes on and validates it, validates the hygienist being awesome, and it's a lot easier. So now back to what do we discuss? Now that we've kind of done the syntax of it, what do we discuss? And where can we bring this in? And how can we bundle it and present it in a fashion that is effective? So obviously we talked about avoiding pain versus gaining pleasure. So next thing that I want to discuss is, when presenting this treatment, let's not talk about the process itself. Nobody goes to the facelift doctor, the plastic surgeon, and says, hey, how are you going to do my facelift? Are you going to take a 15 Bard Parker blade, cut here? Are you going to use chromic suture, gut suture? Are you going to glue it? Patients generally don't want to know that. I mean, there's a group of people that do, because they're a little, off kilter. But the vast majority of people, what they're interested in is, what am I going to look like when I'm done? Because, I'm coming in, my face is all scrunchy and droopy, and I look, like my kids, we do this, skinny person, chubby face thing, the game we play with them. So I'm coming in and I got this, this scrunchy face, and I'm talking to the plastic surgeon, and all I want to know is, am I going to be peeled back, and am I going to look younger? Are you going to get rid of the wrinkles? How many years younger might I look? And then if I dye my hair jet black, which would look really weird on me now, how much younger am I going to look there too? The same is true of dentistry. So it's amazing how if we take a patient that has aged looking teeth and an aged-looking smile. We whiten them, straighten them, clean them, get rid of the dark fillings. It's amazing how when they smile, literally it'll take 5-10 years off. So one of the things I'm always suggesting from a case presentation perspective is shoot a before-after, and not just the smile. I need you to shoot the whole face, because I want the people to see how transformational it is in terms of the results. And if you do that, it's amazing how it will become much, much easier. And the reason why those before-afters work is because you're showing them the potential results with this other person. So when we're presenting dentistry, let's not get into the process, let's get into the results of the process. You know, when you go looking at a house as an example, you're walking through the house, and the realtors, at least a good one, is going to be asking you, hey, could you see your kids playing out in this backyard here? Could you see this? Could you see that? And what they're doing is they're baiting you into seeing the results, seeing the outcome that you're after. And if we can see that outcome and then connect our emotional why we want to do it, why we walked into the practice in the first place, it's a huge, huge motivational tool. Personal trainers do this. My wife does this all the time. Someone will come to her and they'll be looking at her saying, hey, I want to lose like 10 pounds, 15 pounds, whatever it is. And my wife is astute enough that she'll stop them and go, okay, why do you want to do this? And she'll actually have a very in-depth conversation. And it might be, you know, I'm concerned about my weight, and, you know, I want to live longer. And my wife's smart enough to know that that's generally sort of BS answers. So what she'll do is she'll dig deeper. And oftentimes, especially with her female clients, what she'll find out is they're headed on a vacation, and the person doesn't want to be in a bikini feeling insecure around their significant other. And they realize over the past year they put a little bit of weight on. It's natural. We all do it. So now she has great clarity, though, about what's important to this person, why they want to lose this weight. Because let's face it, when we're going through this process, we can lose motivation very easily, especially in the case of weight loss, because it takes time. Now, if your treatment doesn't take a lot of time, they probably won't lose the motivation. But I'm guessing everybody sitting here watching has had a patient where it's a phased treatment plan, and it takes 6 months a year. Implants is a great example. And now all of a sudden you've got a patient who comes in, they start the process, they're sort of midstream, and now they run out of money, which just means they spent it somewhere else, and now you're struggling to keep them motivated. Therein lies a massive challenge, not only from a liability perspective for you and for the practice, but for the patient completing treatment, because now all of a sudden you've got teeth that are mobile because there's nothing adjacent to them. So it's a clinical disaster waiting to happen. So it would be very important to understand in that example, again, what is really their motivator? Why are they excited to do this? Do they want to look younger? Did they just go through a divorce? Are they headed into a divorce? And now as a result of it, they're fighting this age thing because they know they're going to be back out on the dating scene? That's important stuff. So in that process, and of course I'm speaking about bigger cases. If it's a single tooth filling, you don't need to be this complex, obviously. But I want to teach us how to do some bigger things. So in that process, if we're having conversations with them and we can get to know what it is that's important to them and we can keep track of that information, now as we go through this process, this conversation, we get to the economic one, right? Because that's the hardest part. When we get to that economic conversation, it allows us to bring back in that emotional. What is that emotional driver that makes them make a decision? And if we can have that in our back pocket, it's a powerful, powerful tool. And so we need to keep that stuff at bay. And we need to use those examples and those results, those outcomes to help people. So whenever we do coaching, and a lot of you doctors out there who get coaching from our team understand this. Our team often will ask you, what's the outcome you want? And then after you write out that outcome, they'll then ask you, why do you want it? What's important to you? What's the purpose behind it? What's the driving motivation? And if we can come up with the result we want, why we want it, that's compelling, really compelling, people will find a way. It's amazing how someone will look at you and go, I can't afford it, and then they'll do it. You know, I think of this, a patient in Albuquerque, one of our clients, Dr. Prestwich down there. He had a patient walk in the door, and this was when we were real early on with him, so if he's watching this, kudos to you, and I remember the story because it was really profound to me. But he had a patient come into hygiene. He presented an oral cancer screening to this patient for $40, I think was his fee. And the patient said, no, I can't afford it. And what was interesting to me is he said after the fact that right then he would have stopped. He wouldn't have presented anything. But instead what he just ignored that I can't afford it statement, presented her with ortho, presented her with a cosmetic case that was like a $12, $13, $14, $15,000 case. And guess what happened? She accepted it. So she said no to a $40 treatment and then said yes to a $15,000 treatment. Something that he sat there afterwards going, I don't even know what happened here. And it's amazing how presentation is everything. She clearly didn't see value in the oral cancer screening. So bundling can be a very, very effective tool. And I want to play a real short video on that because it plays in perfectly to this scenario. And I think will kind of help wrap all this up. It's only like 2 minutes long. We'll play it and then we'll come back and we'll discuss it some more.
How do people decide to pay for things? What do people decide to buy and not to buy? When it comes to making decisions, people think they're in control. They think they're making smart, rational choices. But in most cases, they are not. For the very first time in the Middle East, Innovity and IXL Center will open your eyes to how people behave so irrationally at the time of purchase, and how you can predict this behavior. We'll show you that consumers are actually not in control of their decisions and how you can make that control happen. Let's take an example. Imagine if a magazine gives you 2 subscription options. Option 1, a yearly online subscription for $59. And option 2, a yearly print and online subscription for $120. Which option would you choose? It depends, right? Well, 68% of people would choose the $59 online option, while only 32% would choose the more expensive option 2. Now, suppose that you add a third print-only option, so that the choices would now look like this. Would people respond the same way as before? No. This time, 84% of people would pick the more expensive option 2. Whereas only 16% would pick option 1. So what could have possibly changed people's minds? What made people skip option 1 and jump to the more expensive option 2? It was the simple presence of option 3.
You know, it's fascinating to me to see how this works and to see research behind it. It's really interesting stuff. And so what we don't want to do, especially if it's bigger stuff, is say, hey, this is the only option. We always want to give people choices because choices allows them to obviously choose. And it's interesting to see how you can compare and contrast various choices. And I would never do more than 3 personally. At least I've never seen research that suggests more than 3 because I think the mind gets confused and overwhelmed, especially as technical as dentistry can be. I almost wonder if 3 is even too many. But if we simplify that presentation and really talk about the results rather than all the stuff, I think you'll see transformation. I think of a client we had in Arizona about 2 years ago, and it was a very, very big practice. At the time, it was a $2.2 million practice, if I recall, single doc practice. 1 doc, 2 hygienists, 3 assistants, 3 front desk, and doing $2 million or $2.2 million. And when he hired us, he gave us the goal of $400,000 in growth. So clearly to do that, we had to focus on big dentistry. And so when we watched him present his cases at the beginning, what he would do is he'd sit down with 3 or 4 pages of notes. We're going to do this, 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 and this. And it was often, phased, of course, because it was big dentistry. And what would happen is people would walk away just with their minds blown about how much and how overwhelming it was. And it was this one this much and this one's this much. And he even phased the pricing of it. And it just was overwhelming. So one of the things we implemented into his practice was, let's bundle this, much like you saw there. So here's option 1, here's option 2. Option 1 is X amount of dollars per month, which we've discussed lots of times here and we can do on another show. And then option 2 is this amount per month. And which one do you think will work best for you? Maybe 3 if it's appropriate, but keep it very, very simple so people can wrap their heads around it. So what he would do is he'd have on 1 page, here's the full mouth makeover, X amount of dollars. And then if he had to do option 2, so let's say it was implants versus a bridge as an example. He'd have a full mouth makeover with implants, full mouth makeover with bridge. That was it. There was no other descriptors there. And as opposed to having 20 line items on 3 pages. So he really simplified it, and he couldn't believe how much it improved things. And then the other thing we taught him was this results thing. So one of the patients I remember seeing, he's had a patient walking in, and it was this 40-something-year-old patient that he talked about implants for a long time with. And he was like, I've never gotten her to do this. It's like 3 years I've been trying to get her to accept this implant. I said, great, do me a favor. When you walk in and you talk about her hygiene, first just talk about that. When it comes to the implant portion of this, all I want you to do is look at her and say, hey, if you decide to do that implant, when I'm done with you, I'm going to give you the smile of a 20-year-old girl. And he was like, you're kidding me. I'm like, no, I really want you to say just that, nothing else. And there were some key words in there that were very, very important. 20-year-old girl. 2 very, very important words. And the reason why it was going to be profound for her is it was a lower missing tooth that every time she smiled and laughed, you saw the hole. So it aged her a ton. So he does that. He walks out, says nothing else, just like I asked him to. We go to dinner that night, and he's talking to his wife who works up front, and he's like, hey, whatever happened with this lady? And she's like, she's scheduled and paid in full. He's like, you got to be kidding me. I've done all these courses, all this complicated training to learn how to present cases, and all I had to do was tell her she was going to look like a 20-year-old girl. I said, man, what you got at was her ego. You got at her vanity. I said, what I saw on her chart was a single woman, most likely recently divorced, who was on the prowl and had no idea what an impact it was going to have on her life. I think if you focus on these results, you bring the results into the conversation, you'll see a massive, massive difference. So next week when we role play some of this stuff, I want to bring in some of the conversation about the monthly payments. I want to discuss some of that content and bring it in because it's germane here. And obviously I can't role play some of this here. But I think if we bring it in and we role play this next week and then button up this whole case presentation thing, I think you'll see transformational growth in terms of your case acceptance. I hope you're finding this content to be very, very helpful for you. I hope you're enjoying it. If you have questions, please email them over to your coach or to myself so we can address them and then maybe bring them in on the show next week. Until then, we will see you next week, 8 a.m. Mountain, 10 o'clock on the East Coast. I hope you have a wonderful week. Bye-bye for now. What if you could have the practice of your dreams? What's holding you back? Imagine a life where you have everything you ever wanted.